I am Dr. R V Narayana, consultant neurophysician at SevenHills Hospital, Visakhapatnam. So I am going to talk to you about stroke. Every year, 29th October, we celebrate World Stroke Day. So because stroke is a very important neurological disease, affects young and old people throughout the world. So there are about, according to Indian Stroke Association, there are about 1.8 million people suffer each year with stroke in India. So stroke means it's a brain stroke, sudden acute neurological deficit. That means if a person can have, suddenly he may lose his speech or he may lose his limb power. That means either a hand or leg weakness, or his eyes may deviate to one side, or he may suddenly lose his balance. So we call it as a B fast. B means balance, I means eye deviation or sudden loss of vision in an eye, and then F means facial deviation, something like this. A means arm drift. S means speech difficulty. T means time to reach to the hospital. This is for the public awareness. Be fast. So that means you have to take all the stroke patients immediately to your nearest hospital, so that acute treatment, that means sudden treatments, that means immediate treatments can be given for these patients. If you give immediate treatment, these patients, they do improve their limb power, speech. We can save lives of these people. So there is a drug called clot buster, which should be given within 4.5 hours of the stroke onset. So this clot buster dissolves the clot in the blood vessels of the brain, so the patient can speak normally, so he can recover his weakness faster than without treatments. So I request all the public to be aware of the stroke symptoms and bring these patients early to the hospital. So in the prevention of stroke, we call it as a primary prevention. There is what are the risk factors you look for them in these patients. So if somebody smokes, so smoking is a risk factor. Somebody's high blood pressure, hypertension is a risk factor, and diabetes mellitus is a risk factor. Heavy alcohol drinking is a risk factor. So these are all the risk factors. Apart from this, so high lipid levels, that means high cholesterol levels in the blood, that is also a risk factor. So if somebody has all these risk factors, so you have to treat them accordingly. So that is called, if you know when the patient has got all these risk factors, if you treat them, this is called primary prevention. Secondary prevention is one, after the stroke has happened and he has received the acute treatment, we give secondary treatments. This is secondary preventive treatments. These are usually antiplatelet drugs, anticoagulants, apart from neuroprotectives. And then we give these treatments and send these patients for rehabilitation. That means physiotherapy, occupational therapy. These are rehabilitation therapies. So if you do all these things, patients, they do recover early, and we can save these lives, and then reduce the burden on the family for these patients. Thank you.